This week, we will discuss the role of the DMP in affecting quality and safety outcomes. We will also look nationally at accepted quality benchmarks used to help guide healthcare providers. Several weeks ago, we discussed on our discussion boards the differences between the DMP and the PhD. The DMP translates current research into current practice. This is just one of the roles of the DMP. They also are involved in quality projects that help to ensure patient safety. The PH nurse also plays a role in improving quality and safety outcomes. Oftentimes, their role is generating new knowledge that needs to be implemented in practice. The advanced nurse educator also plays a role in educating nurses on quality benchmarks to improve safety and quality in the healthcare field. This week, we will look at several branch benchmarks that are used to measure quality. I have attached some commonly used references. There's not a chapter in our course that will correlate with this week. I want you to go through some of these references, but I do not expect you to read them. They are a reference for you to use as you're formulating your DMP projects and coming up with quality improvement projects. They are referenced to use the way other medical references are. So example, you don't read all of Hippocrates, but you use it when you're prescribing a new antibiotic. That is how you to use these readings. If you notice, there are a lot of readings. They're to be used as a reference. Let's discuss the first benchmark. The first benchmark is the graduate level QSEN competencies. This kind of evaluates knowledge, skills, and attitudes. QSEN stands for Quality and Safety Education in Nursing. QSEN represents an initiative in the nursing field to align nursing education and nursing best practices in quality and safety standards. This was formed because of calls to improve quality and safety in nursing. The QSEN competencies are patient-centered care, evidence-based practice, teamwork and collaboration, safety, quality improvement, and informatics. These are zones of nursing that work together and represent areas where quality and safety standards should be practiced. Each competency involves skills, knowledge bases, and attitudes nurses should have on each topic. QSEN competencies don't only apply to the individual, but can also be applied to a medical system. Some of the examples of QSEN in systems are like a new nurses orientation at a general hospital. Competencies are often emphasized and reviewed as nurses have a week-long orientation with demonstrations or tests to verify these competencies. You can find these competencies in the article that's attached to our module. QSEN also provides competencies for healthcare providers that give current standards of practice. For one, there is actually some that's kind of apropos for our current situations. There are some guidelines on coronavirus. I'm going to go ahead and go to the website so that you can see what some of those resources look like. Okay, we're now at the QSEN Institute's website. And if you look across here, it has a homepage, education practice resources. Some of the resources I want you to know, it has some academia resources, some practice partnerships that can actually help you find other people to go into research with, has some courses, has some COVID-19 community outreach. My favorite is the evaluation tools that can kind of give you some of the tools you need to use for a benchmark. So if you think about this, a lot of our discussion so far has talked about benchmarks for quality, which is important. But if you're going to implement a research project, whether it is a clinically based one for a DMP or a research-based one for a PhD, you need a validated tool for outcome measures. And this is a website where you can actually already find one that's validated, which is really a great resource. And then it has some learning modules that can also be of assistance. So this is a great tool for you as you're forming your, to be honest, your project. One of the things I'm hoping this course can do is help you if you are seeking a terminal degree. Think of some of the things you want to do, but also think of some of the think of how that looks and what does a DMP project looks like. And so it looks like finding a benchmark, finding a qualitative tool or a quantitative tool, and then measuring an outcome. Let's go ahead and click on one of these and see what it looks like. All right, so this actually opens up for us some information about the coronavirus, which is just very applicable for what we are going through right now. It talks about some information for the community and some benchmarks for standards of practice. One of the things that I like is it actually hyperlinks to other good resources like the World Health Organization and CDC, but it also gives some good references for educators. Some of the questions that comes to my mind in my role, and many of you actually are educators in this course and are also in the same position. Some of you guys are teaching didactic courses, and some of you guys are clinical educators or even educators in the realm of teaching in, in the actual clinical setting. What I like is the question has come to my mind: when do we put in the middle of this pandemic, when do students return to the clinical skills lab and SIMS labs? And these are really important learning landmarks. I don't think the current nurses that are getting their BSNs and the advanced practice nurses who are learning their advanced practice clinical skills can become efficient beginning providers without these skills. So it actually gives some requirements to healthcare professionals right here, and when we can bring in the students and how to decrease risk to the students. You can hyperlink to all of these and click on them. I've read through them, so I'm kind of speeding through some of the information that's on there, but I found it was really solid information when I've started taking students get in my own clinical practice, giving me some guidelines as even just a preceptor at how I might limit the risk but still facilitate the education. So these are some important examples of how Benchmark works both in the education system and in the clinical system. All right, the next benchmark we're going to go ahead and look at is from the Institute of Medicine, and it's titled Keeping Patients Safe, Transforming the Work Environment of Nurses. Okay, when you are accessing this resource, I think you will find Canvas has an actual difficult time linking out. There's two things you can do. You can copy the link and put it in another browser if you want to link to the actual website to have access to that information. But I have also downloaded the PDF and attached it underneath the link so that you can double click on it and just access that information through Canvas. So one of the guidelines from the Institute of Medicine states, "To err is human, and crossing the quality chasm, keeping patients safe, lays out guidelines for improving safety by changing nurses' working conditions and demands." So the basic idea of these guidelines are the idea that when we have unsafe nursing environments or unsafe demands for our nursing force, that we have poor patient outcomes. So the Institute of Medicine has come out with this idea that if we can find benchmarks that look at the quality of the environment for our nursing practice, that we're going to increase outcomes. And I think we all kind of know this. While they put language to it and do research and put some actual numbers to it, I think we know the nurse who sees 30 patients in a day who doesn't have good support is going to make a mistake. Fatigue is the enemy to us all. I can't help but reflect at some of the things I've been seeing in the last couple semesters in healthcare and also in my own clinical practice. I think in certain areas of the country there are higher expectations to our nursing staff. In my own clinical practice, we're on mandatory overtime. That means everybody works 48 hours a week. Well, times that by 8 months, I feel like our mistakes have gone up. We're tired. The environment isn't good. When I think of the beginning of COVID, when you look at New York, the environment wasn't safe because healthcare providers and nurses and clinical support staff didn't have the appropriate PPE. We weren't ready for the upcoming pandemic, and this resulted in putting our nurses at risk and our clinical staff. As nurses got sick and as nurses had coworkers and colleagues die, this changed the mental health of the scene. And I think our last discussion board discussed this a lot, but I think we all know that there's the environment, but there's also that mental health that comes to place. And I think as healthcare providers have been practicing medicine in a very unstable situation right now, it adds to decreasing the safety of our environment. A good example of this is going to work and not knowing, will I have the appropriate PPE? Will I have enough staff to run my unit? Will I be able to meet these new demands? We've discussed a lot about role strain, and this does equate to a lot of role strain, but I also have to think about the mental strain and the environmental strain that these are causing. So COVID, if I would be honest, it is like this magnifying glass to the cracks of our healthcare system. It is showing us what was already there. And this week we're discussing these benchmarks of how to improve these environments and how to improve outcomes. And, the hope behind my clinical practice as an educator is that we are training the next level of advanced practice nurses and educators and researchers to bring up healthcare, to make it more safe, to change it. And we do this through benchmarks, and we do this through evidence-based practice, and we do this through research. When I think about every single role that's probably in this class, from our certificate to the PhD, all of you will play an important role to what healthcare looks like in the future. And my hope is that it looks better, that it is a safer place, that when you guys graduate, what we're seeing now is better. Okay, so let's talk a little bit more serious. When you think about the nature of what nurses do, we participate in many areas, such as we monitor patients, we educate home caretakers. Picture all the nurses we have in people's home setting. There is a world of unstable environments, right? We perform treatments and resuscitations. To say the least, there's many levels to have error as nurses and as advanced practice nurses. The Institute of Health uses these different areas to document and make changes in the organization and delivery of healthcare. Ultimately, it's to shape the job description and environment nurses work in. This document will discuss key aspects of the work environment for nurses and reviews the potential improvements in working conditions that are likely to impact patient safety. When you think about doing a quality improvement project, this is actually the type of evidence you bring to your Institute of Practice, right? So if you were looking at having you're in a non-unionized state and you've got 8 patients per nurse and it's just not really something you can do, you kind of want to bring a little bit of evidence to the discussion. And these are the type of things you can bring out by saying that Institute of Medicine has said not to do this, and you can kind of go through this. So I would advise you to just look through this document. It is large. It's 485 pages, so I obviously don't expect you to read it, but you might go through. It has a reference page, and you might go through some of the areas that you find interesting and that are more applicable to your area of practice. So if you're in education, you might want to look at the stuff that talks about the safety of SimLab. If you're someone who's in clinical practice, you might want to discuss more about the safety of a nursing environment during a resuscitation. So I really like this document because I think it covers a lot of the areas that we need to increase standardization of practice standards within the field of medicine. Okay, let's go on to the next benchmark. Okay, so the next benchmark is Quality Measures of Health by the Institute of Medicine. The Institute of Medicine Committee on Quality Measures for Health People Leading Health Indicators was charged by the Office of Assistant Secretary for Health. Basically, this is to identify measures of quality for the 12 leading health indicators. These are topics and 26 leading health indicators in Healthy People 2020. The way I look at this is implementation of the Healthy People of 2020. We came out with some health indicators, and these are those benchmarks to get those health indicators. The current version of the Department of Health and Human Services has a 10-year agenda for improving the nation's health. And remember, this was 2020 before we realized there was going to be a pandemic. So I can only imagine the difficulty of meeting these benchmarks under our current healthcare culture. The goal, though, is to use 9 aims or benchmarks for improvement of quality in public health. The committee basically reviewed existing literature on the 12 LHI topics and the 26 leading health indicators. So they looked at what the leading health indicators were and then came up with benchmarks, basically. So toward quality measures for population health and the leading health indicators, what this document does is it provides recommendations for how we can measure these indicators across sectors of the public health and healthcare system. So there's one thing to have a benchmark, and we talked about this when we think about our projects. And another thing is to realize how to measure, and that again is having a tool. So this is another document that when you think about the quality improvement projects you're going to do as an advanced practice nurse or someone who is obtaining a new role as a certificate and maybe will be involved in quality improvement, this is going to give you some of those indicators where you can measure outcomes and make sure what you're doing is basically achieving these benchmarks. The 6 areas, also known as drivers, are population health metrics and information technology, evidence-based practices, research and evaluation, system thinking, sustainability and stewardship, policy, and workforce and education. Again, this is a large document. You might want to just go through it. I posted the entire document onto the Canvas so that you have access to it. And again, I want you to use this as a reference. The goal is not that you guys read all of these, but the goal would be that you kind of go through it and see, looking at the reference section, what areas are of interest to you, and that could help you possibly in a future project or on your DNP or PhD, and kind of see some benchmarks and some qualitative tools or quantitative tools to measure outcomes and kind of just get an idea of what that project might look like. So that's kind of the goal for this. Okay, lastly, we're going to talk about the National Practitioner Data Bank. Now, this is actually amazing to me. I didn't even know about this until I started teaching this course several years ago. In my own clinical education, we never talked about this. And it's kind of amazing to me because I'm a midwife, and you have to know we have a 99% chance of being sued. So this guidebook kind of basically gives you what all the malpractice is for your field, what the current national guidelines are. It is honestly probably one of the most important references I have used clinically, and I think it's invaluable. So we're going to talk a little bit about how this came about. And again, this also focuses on benchmarks in healthcare. It's going to talk about what the standards are. It's going to be what's the national set standards. So if you have a practice and you think you're not meeting the standards, this is something to bring about. And it's also going to focus on what the malpractice is to not meeting the benchmarks. So this to me is kind of a guidebook that is where the rubber hits the road. All of our other ideas have been very good ideas about improving quality within healthcare, but they've all been just theoretical ideas, right? Like, this is what we should be doing, but if we don't do it, I guess we just aren't as safe. This is kind of like, this is what we should be doing, and if we don't do it, this is what your malpractice suit looks like. So this is kind of, when you think about the litigiousness of healthcare, worth a look. So let's talk about how this kind of came about. Congress enacted legislation that led to the creation of the National Practitioner Data Bank. And basically, Congress perceived that increasing occurrences of medical malpractice litigation, that there was a need. So basically, they're looking at all of these different litigation, and they've basically viewed a need to improve the quality of medical care. And they viewed it as a nationwide problem. So this is where you think about state versus the nation. So they felt like there needs to be some standardization among the states that warranted greater efforts that could be undertaken by an individual state. So view this as the national government basically giving some guidelines per the states. Congress also identified the need to restrict the ability of incompetent physicians and dentists to move from state to state without disclosure or discovery of the physician's previous practice or incompetence. So if you think about this, before this kind of came out, there was the ability for a doctor to maybe, become unable to practice in one state and to float states, which is dangerous. So this is some very important legislation. Congress also felt that the threat of private money damages and liability under federal laws, including terrible damage liabilities under the federal antitrust law, unreasonably discouraged physicians and dentists from participating in effective professional peer review. So let's break that down. Basically, they think that maybe physicians, because they're worried about liability, are not going to go to peer review, and they're probably correct. So this is kind of a form that you can see what's going on in peer review without the liability. So it gives you the ability as a provider to see what is going on and review each other, but one that doesn't lead to something litigious unless you, again, get in trouble within your own state. Okay, so therefore Congress sought to provide incentives, and these incentives are protection for physicians and dentists that are engaging in effective professional peer review. So part of what makes this database is that when a physician participates in it, they have a level of protection, and that is an incentivization so that they want to. So Title IV led to the establishment of the National Provider Practitioner Data Bank, and it's basically like an information clearinghouse. The guidebook serves as a policy manual. It is one of the number of efforts to inform the U.S. healthcare community and others about the National Practitioner Data Bank and the requirements established by the laws governing the NPDB. I would have to tell you, they are doing some more efforts to make providers more aware of this. To put it in a nutshell, it is basically the ability to look at standards of practice, do a peer review in a non-litigious setting, but also it outlines what is considered malpractice and kind of gives a standardized guidance across states. I don't think this is actually, and maybe it was only in my clinical experience, but this is not something I had referenced prior to the teaching. There could even be, when I think about DMP projects, a DMP project could even be making this type of guidebook more well known and doing a pre and post education session on it and seeing if there was improved education after presenting it, and kind of seeing, would providers change their standards? Would providers look at this and evaluate their current practice? Does this create this type of clearinghouse? Does this create the ability for providers in a non-stressful environment to evaluate their current practice, to standardize practices and adjust? And if you think about it, if it does, there's where the power lies. If as a midwife, I can look at what they consider standards are in my field and see where I'm not living up to them and change it, that's a behavior change, but it also improves my practice and increases standards of benchmarks in healthcare. So these are, for me, this is probably one of the, I feel like with this week, probably one of your best take-home finds. So my hope is you'll look through it. I would spend some time with it. Some of the main sections that I've looked through that are kind of, everybody has areas that are more interesting, but what's interesting to me was looking at the medical malpractice payment report. This is literally just like how much money went out for each area. It's interesting to me because birth, you have a TEL, so you have a long time you can sue a midwife. And so I love seeing what people are paying out for. You can also look at judgment or conviction reports and adverse action reports. So this is kind of an area to see just a nice way to look at what's going on in healthcare on a non-stressful way to compare your own practice and kind of look at your own ability to change. Okay, so this week we've talked about the role of both the DMP and PhD to help improve healthcare outcomes by reaching quality benchmarks. Many of you will be seeking either a research-based or clinical terminal degree. These benchmarks are easy quality improvement projects that you could implement as a DMP project. Those who are acquiring the PhD can build upon current recommendations. An example of this would be to build on the Institute of Health's research by examining the environmental risks to nurses in relation to COVID and compare it to poor patient outcomes. For those of you who already have a DMP, those benchmarks you can use for quality improvement within your own institution practice. And for those of you who are educators, this is an ideal time where you can present these benchmarks to your students and help them with their own projects. So this is kind of a take-home because I know there are many educators in this class. I think for those of you who might have BSN students who are thinking of moving on to the DMP role, this kind of gives them an idea of what a project looks like. I think it's nice to outline for a BSN student who's thinking of this type of growth. While they only have to do it a step at a time, it's good for them to know that there's tools out there. They're not recreating the wheel. They can go out there, find a standardized benchmark, find a tool that has already been validated, and implement a project. And my hope is, I'm not sure in undergraduate education if we're teaching enough of this, but my hope is for those of you who are in undergraduate education that maybe you can take a little bit of this to your students, because I can't help but I dream of everybody just growing in their field and nursing growing and having, all these doctoral level nurses who are improving healthcare. And I guess I can dream of that, right? Because I see that all the time. And we have students who are all the time exceeding my expectations and growing, and I'm watching their careers grow. And that for me is what makes this job most fulfilling. These benchmarks basically give us goals as advanced practice nurses to elevate healthcare too. And thank you so much for your time today.